Assalamu alaikum wa rahmatullahi wa barakatuh. This is your brother, Dr. Abu Isa, and I'm doing a short video today on depression because I'm getting a lot of messages from people to talk about different mental disorders and specifically about low mood and depression. So inshallah, I will talk very briefly because it's a large topic about depression, what it is, and how we treat it. So there's many different definitions of depression, but essentially it's a mood disorder that causes a persistent feeling of sadness and loss of interest. It's also sometimes referred to as major depressive disorder or clinical depression. And essentially it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. So you may have trouble doing normal day-to-day activities, and also some people experience suicidal impulses and ideation. So in terms of how common is depression worldwide, well, from the World Health Organization, it is a relatively common mental disorder. Globally, it is estimated that around 5% of adults suffer from depression, and similar percentage of young people. It's a leading cause of disability worldwide and is a major contributor to the overall global burden of disease. We know that women are usually more affected than men by depression. And as I mentioned earlier, it can lead to suicide or deliberate self-harm. And we do have effective treatments. So it's estimated that around 3.8% of the world population is affected by depression, which equates to around 280 million people. And in terms of what are the symptoms, there are different symptoms, but like I mentioned, an individual experiences depressed mood, which can manifest as feeling sad, irritable, and empty, or a loss of pleasure or interest in activities, which we call anhedonia, for most of the day, nearly every day for at least 2 weeks. Several other symptoms also present, which may include poor concentration, feeling guilty, and experiencing kind of low self-worth, hopelessness about the future, suicidal impulses, disrupted sleep, changes in your appetite or weight, and feeling especially tired or low in energy. What's interesting is in some contexts, people may express their mood changes more readily in the form of bodily symptoms. So this is particularly common amongst the South Asian community, especially females that we see. They usually present with chest pain or difficulties with breathing or chronic pain. So it's psychosomatic. So there's no kind of underlying cause for these physical symptoms. And usually there's, an underlying physical cause. And usually it's related to psychological distress, domestic violence, conflict, etc. And we categorize a depressive episode as mild, moderate, or severe, depending on the number and severity of symptoms, as well as the impact on somebody's functioning. There are different patterns of mood disorders, which include a single episode depressive disorder, meaning that this is the person's first and only episode. They can have recurrent depressive disorder, which means that the person has a history of at least 2 depressive episodes. And then bipolar disorder, which means that depressive episodes alternate with periods of manic symptoms, which may include euphoria or irritability, increased activity or energy, and other symptoms such as being very talkative, racing thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulsive and reckless behavior. Okay, so what about the causes of depression? So there's usually a combination of genetic and environmental factors, but specifically we can kind of divide the causes. So first thing to say is that we don't know exactly what causes depression, and as with many mental disorders, it's multifactorial. So there may be biological differences. So people with depression may appear to have physical changes in their brains, and this is seen through functional brain imaging. And the significance of these changes is still uncertain, but may eventually help pinpoint causes. There's also brain chemistry, or what we call the monoamine theory of depression. So neurotransmitters, these are naturally occurring brain chemicals that likely play a role in depression. And research indicates that changes in the function and effect of these neurotransmitters, particularly serotonin and also noradrenaline, and how they interact with neurocircuits involved in maintaining mood stability may play a significant role in depression and its treatment. Another cause is hormones. So changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy. So that would be, it's common for pregnant women to suffer from depression, and during the weeks or months after delivery, postpartum. So that's called postpartum depression, from thyroid problems, menopause, or a number of other conditions. There's also a genetic component. So we know that depression is more common in people whose blood relatives also have this condition. And research is ongoing in trying to find specific genes that may be involved in causing depression. Treatment, we have psychological, social, and medication interventions to treat depression. So most people usually ask about medication. So the commonest medications are called SSRIs, selective serotonin reuptake inhibitors. And as I mentioned earlier, they specifically work to increase the levels of serotonin, which is the brain neurotransmitter in the brain, which in turn helps to improve mood and treat the depression. Common SSRIs are things like fluoxetine, which is referred to as Prozac, sertraline, citalopram, and then we have other antidepressants which work slightly differently, something called mirtazapine. So these are the kind of the commonest medications. Medications are very effective in patients who are suffering from moderate to severe depression. They have to be taken daily, and unfortunately can take between 4 to 6 weeks before you notice a significant improvement in your mood. So one of the challenges we have is that patients, they discontinue this medication because they don't notice an improvement in their mood. Once you are stable on medication, you should continue it for at least 6 months after recovery from a depressive episode. So that may be, so if you start treatment, it may take three to 6 months to recover from a depressive episode. Then it should be taken for at least another 6 months before you consider reducing the dose and discontinuing it. And that needs to be done under medical guidance and supervision. Common side effects, depending on which medication you take, but you can get nausea, vomiting, abdominal issues. They are not addictive, so that's not a concern. Sometimes it can make anxiety and depression worse, and very rarely patients report increased suicidal thoughts. During the kind of the titration phase, it's very important that you have medical supervision for that. In terms of other treatments, psychological treatments, common treatments we use are CBT, cognitive behavioral therapy, which is essentially talking to a psychotherapist about thoughts, feelings, and behaviors and how they all interact. So when somebody's depressed, they experience what we call negative automatic thoughts, which they find difficult to manage and can result in low self-esteem, low self-confidence. So CBT essentially is usually on a weekly basis, one session, 50 minutes to an hour, where the therapist works with the patient to go through their thoughts, feelings, and behaviors in certain situations, and to develop coping strategies and to kind of lift them from their mood. There's other treatments like mindfulness, DBT if somebody's self-harming, but the commonest psychological intervention and what the evidence base shows is that the combination of usually CBT with an SSRI or other form of antidepressant is the most effective treatment. Then we also have social interventions. So depending on each individual case, there may be social issues around marital conflict, depression, trauma, which needs to be addressed. And that may be done through a social worker and or psychologist and psychiatrist. And then obviously as Muslims, we always start with the Quran and Sunnah. So we know that increasing your iman, increasing your ibadah, improving your relationship with Allah subhanahu wa ta'ala, reading more Quran, tahajjud, qiyamul layl, these are all interventions that inshallah will help patients who are suffering from depression. Lastly, suicidal thoughts and suicidal impulses. This is unfortunately increasingly common. So we see a lot of particularly young people who are going through difficult life circumstances, maybe bullying, cyberbullying is now on the rise, trauma, whether that might be any form of abuse, engaging in self-harming, such as cutting and taking overdoses. So this usually results as an impulsive act, as a result, secondary to emotional dysregulation, maybe conflict with somebody's parents, etc. So we take these things seriously. A lot of young people and even adults who self-harm don't have suicidal intent, but they want to get rid of stress. So we work with these patients in developing better coping strategies and not destructive strategies such as self-harming. And then the more worrying aspect, which can be related to depression, but also other mental disorders like PTSD, psychosis, is suicidal impulses and ideation and attempts. And this is a complex topic, which inshallah in the future, I will try and do a video and maybe a topic for a podcast episode with Gabriel. Suicidal thoughts and are common, but not everybody acts on these thoughts. When an individual experiences severe depression and hopelessness, they are more likely to act on these thoughts. So it's very important as a Muslim community that we open up conversations within our families about feelings and emotions. So if somebody is experiencing suicidal thoughts, I can't stress how essential it is that they talk to somebody that they trust, because bottling it up will make things worse. So it needs to be addressed, and it's not something to be ashamed of. It's very common, unfortunately, especially now as life is becoming increasingly stressful. You need to, if you are experiencing this, you need to reach out to somebody you trust and seek specialist help. Inshallah, that was beneficial for all of you. Please remember me in your du'as, and until next time, Assalamu alaikum wa rahmatullahi wa barakatuh.